Ashley, and today I'm going to talk a little bit about the Panic Disorder Severity Scale. The Panic Disorder Severity Scale is a self-report scale that clinicians use, and it's quickly become one of the most commonly used severity scales in clinical settings. It consists of 7 items, each rated on a 5-point scale. The items assess panic frequency, distress during panic, panic-focused anticipatory anxiety, phobic avoidance of situations, phobic avoidance of physical sensations, impairment in work functioning, and impairment in social functioning. And the scale in general can be administered in about 5 to 10 minutes depending on the client. In general, the Panic Disorder Severity Scale is a useful way of addressing overall panic disorder and severity at baseline, and it provides a profile of the severity of different panic disorder symptoms. It's rated differently depending if the patient has or doesn't have agoraphobia. So the test is not diagnostic. However, a score of 9 and above suggests the need for a formal diagnostic assessment. So scores, if the patient is in therapy and this is given to the patient during therapy, their scores are very sensitive to change after psychological treatment. So in general, that means the test has low retest reliability. So each question in general is under copyright for this exam. So only trained clinicians with copyright access are able to use this scale. In general, it's a very reliable test. It has good internal consistency and great reliability. So a couple of reasons why I chose this to talk about with panic disorder was because it's fast to administer. If you are a therapist, you can easily track your patient's self-reported progress and see how they're progressing during treatment. It's also reliable, valid, and also easy to administer. So I'm going to show you how easy that is to administer with my classmate Lexi here. So Lexi, several of the following questions on this list refer to panic attacks and limited symptom attacks. For this questionnaire, we define a panic attack as a sudden rush of fear or discomfort accompanied by at least 4 of the symptoms listed below. In order to qualify as a sudden rush, the symptoms must peak within 10 minutes. Episodes like panic attacks, but having fewer than 4 of the listed symptoms, are also called limited symptom attacks. And here are the symptoms to count: rapid or pounding heartbeat, sweating, trembling or shaking, breathlessness, feeling of choking, chest pain or discomfort, nausea, dizziness or faintness, feelings of unreality, numbness or tingling, chills or hot flashes, fear of losing control or going crazy, or fear of dying. So I'm going to give you this assessment, and I'm going to have you rate each of these questions for me and just let me know when you're done. Okay. And as she's taking this is kind of what the test looks like. These are the instructions I read her, and then there are 7 questions like I stated earlier.
Okay.
All right, thank you. And I'm going to score this real quick, and then we're going to talk about your results when I'm done scoring. All right, so earlier when I was discussing about scoring the test, I did mention that it is scored for a patient with agoraphobia, and then it can also be scored for a patient without agoraphobia. So the skill ratings range from normal to borderline to slightly ill to moderately ill and to markedly ill. Now, you scored an 11 on this test, which means that if you did not have agoraphobia, you would be considered moderately ill, and so we would need to seek some treatment for you for your panic disorders. And then if you did have agoraphobia, you would also be moderately ill, so we would need to take some action on that. Okay. All right. Thank you so much for taking this test today.